It's beyond doubt that healthcare expenses are increasing quite substantially, and that in the longer run we have to think how we allocate our resources in the most optimal way to benefit every cancer patient. And in that respect, the first topic that we discussed was trying to give an overview of how health economics helps radiation oncology, the access to radiation oncology, and how it may benefit to our patients. And in that session, I discussed indeed what the role is in a more global way of health services research in radiation oncology, because it's not only about health economics in the very strict term, it's also not only dealing with cost and cost effectiveness, that was dealt with by my colleagues actually, but I was also speaking about the fact that if you cannot bring your new technologies, your new treatments to the patients, if you cannot improve the access to the treatment, and another thing is to improve the quality of the treatment, then you will not really get the full potential of the novel technologies and the new treatments that you're delivering or developing in a biomedical research. You also have to find a way to bring it to your broad public of patients in Europe. So that was actually what I was discussing, how to deal with this and how this type of research can be set up. Well, I think that's in that respect, Europe is maybe not so different. Of course, probably I cannot completely compare with Latin America, but we also face in many countries in Europe a lack of resources and a lack of personnel, well, as well personnel as infrastructural resources. And this is very variable across Europe. We know that there's a large variability, large heterogeneity in Europe in terms of availability of modern radiotherapy equipment, highly qualified radiotherapy personnel. And we know that this is in part linked to also the needs, which may be different from one country to another, because we know that, for example, cancer epidemiology is different, incidence is different in different countries. So that has an impact on how much you need in terms of resources. But we know that there are other factors obviously playing a role, and one of them is the national income of a country. And we know that countries that have a lower gross national income are typically less well resourced, and that will have an impact as well on the way we can deliver the treatments. And we also see, for example, that dedicated or more specific high-tech radiotherapy equipment is somewhat slower taken up in countries with a lower income. So these are issues that are very typical, I think, in more low and middle income countries, but we see the problem in a region that is typically seen as a high income region as well, because there's a lot of disparity across the whole of Europe. The major conclusion, I think, is that we have to know and be aware that also in Europe there's a high variability in terms of resources available, a high variability in the needs, and that if we want to help the countries in trying to optimize their equipment and get the right personnel trained in a timely manner to help each cancer patient, then we have to do the exercise of having a good idea of what the cost of radiotherapy is, and then to implement these data in correct cost effectiveness evaluation so that we can indeed support our radiotherapy technology and radiotherapy treatments by the real correct evidence that helps the national counterparts to discuss with their authorities and to bring the best possibilities of radiotherapy to the patient.